Good afternoon. County Executive Rich Fitzgerald here, along with Dr. Deborah Bogan from the Allegheny County Health Department, doing our weekly update on the coronavirus pandemic. As we head into December, we know November has been by far the worst month we've had when it comes to testing, cases, positivity, hospitalizations, etc. So as we're heading into the colder weather, we've really got to continue to follow the advice that's being given to us locally by Dr. Bogan and all the way up through nationally by Dr. Fauci, Dr. Birx, and our experts at the CDC. We know we've come through some difficult times with the Thanksgiving weekend and a little bit of travel and things that are going on. But it's kind of like the best of both worlds, or the tale of two cities. The vaccine is coming. In fact, already distributed today in the UK. And most likely next week, things will also happen here in the US, in our community, as well as communities across the country. We'll get into that in a little bit, and how vaccines and those type of things will happen. But we really have to continue to wear our masks, keep distance, not engage in gatherings of very many people, particularly among people that could be carrying the disease. So in any event, I'm going to turn it over to Dr. Deborah Bogan. She's going to update us on where we are, and again, continue to be vigilant. We got to keep working at it. We're getting close. As I know, some of you might not even be on now because of the other thing that's going on in town, but in using that parlance, we're in the red zone, and we want to make sure we score. So Dr. Deborah Bogan.
Thank you, County Executive. Good afternoon, and thank you all for joining us today. I am not going to spend too much time on our numbers. If you read the COVID daily updates the health department sends out every day, or follow us on social media, you know that the numbers are, and you know that they remain high. There were 12,608 new cases of COVID reported among Allegheny County residents in the month of November. 12,608. To put that in perspective, cases from the month of November account for 40% of all the cases since March, making November by far our worst month yet. 2 weeks ago, I issued my stern public health advisory telling people to avoid social gatherings and stay at home, only leaving for essentials like work, school, to get food and exercise. The numbers haven't really dropped during that time. Deciding what to do next beyond an advisory means taking into consideration many aspects of public health. On the one hand, we have the pandemic, a virus that is infecting more and more people every day, keeping them away from their jobs and school, sending some to the hospital with severe illness, and killing far too many. And in many parts of our country, the pandemic has resulted in overrun hospitals. And our goal is to make sure that does not happen here. According to state data, at the height of our summer surge, about 170 people were in the Allegheny County hospitals with COVID-19. Now there are about 500, and we know that will increase over the next few weeks. However, our county hospitals have thoughtful and robust plans to expand bed capacity for more patients. The bigger challenge is staffing those beds to care for the patients, including not just nurses and doctors, but also all the other services such as radiology, respiratory therapy, cleaning and food services, among many others. In some hospitals in our region, our healthcare workers are already quite stretched. Compounding the challenge is wide community spread of the virus. Healthcare staff are increasingly getting sick themselves, and many others are home caring for their loved ones who are either sick or in quarantine. And those going to work day after day, caring for COVID patient after COVID patient, can get worn down. This is really a marathon, not a typical cold and flu season with a busy week or a couple weeks here or there, but rather lasting for months. I have tremendous respect for our hard work of all of our healthcare workers, but we have to recognize that they too have limits, and we need to all do our part to make sure they too are cared for and not overwhelmed. So that's on the one hand. On the other hand, we also have to consider the public health effects of orders that we would put out that could impact our economy. Closing businesses now comes with more pain than in March. Gone is the financial assistance to businesses and the extra unemployment to laid off workers. We've seen broad impact of COVID-19 on our community's health, including making it more difficult for families to put food on the table and keep roofs over their heads. So I just wanted to share a little bit of data of how COVID-19 has impacted our community. In August 2020 compared to August 2019, there was a 104% increase in initial claims for unemployment insurance and a 597% increase in continued claims. The food insecurity rate increased by 42% from 2018 to 2020. And the number of children living in food insecure households is projected to increase by 61% from 2018 to 2020. And since June, Allegheny County has seen a 27% increase in SNAP applications. Regarding mental health, the number of total calls for mental health crisis has been increasing each month since April 2020, as have calls to the Peer Support and Advocacy Network. And among families who completed the Family Strength Survey, 25%, a quarter of them, reported that they felt they were not able to completely support their children's social, emotional, and mental well-being. And fewer were able to support their own emotional and mental well-being. These are also important public health issues. So there isn't one simple solution or answer. I'm hoping the stay-at-home advisory and the state orders will have an impact on our cases in the coming month or two, and we are following that closely. I have also asked the leaders of our region's healthcare system to keep me well informed and to give me fair warning if they foresee a crisis situation. I've told them that changing the course of the pandemic is a lot like piloting a large ship. It takes a while for mitigation measures, if ordered, to turn it around, and they all understand this. And I've promised you several times before that I'm going to let science and data lead my decisions. And I again tell you that is what I'm doing now. The data and the science this time are really coming from the hospitals. That's the trigger. But it's not completely out of our control outside the healthcare system. We can start to turn the ship even without drastic turn of the wheel. Things that we can do things we can control are our social interactions with others. Please, I ask you again, limit or stop your travel. Reschedule any parties or large events for the spring. Avoid gatherings with others inside and wear masks and stay 6 feet apart whenever you do. I'd like to end on a more positive note. The health department continues to work hard to bring more testing into communities around the county. This week, actually today, we started a mobile testing service using a van from Curative. That's a company that's been doing our testing. We've been using it in our federally qualified health centers. The van is big and bright purple. You cannot miss it. It will be at sites throughout the county offering free COVID testing. We'll be promoting its locations on our social media accounts, so be sure to check there if you need a test. Curative will bill insurance when appropriate, but I want to assure you that COVID-19 testing is available to all individuals regardless of insurance status or ability to pay for services. Those without insurance or those whose insurance will not cover the test will receive the test without charge or billing. So please, if you have insurance, use it, but otherwise, we've got you covered. Curative will also begin offering testing on Saturdays at the McKeesport test site starting December 12th. So not this weekend, next weekend. More information is available on our website. One more thing, the CDC announced today changes to its recommendations on how long someone should quarantine. These changes were really just announced today, so I ask that you be patient with us. We are just reviewing their guidances, and we are going to discuss that with the Pennsylvania Department of Health and get back to you on our local recommendations. I know many of you have questions about COVID or how to stay safe or in need of help if you're told to isolate or quarantine. I want to remind everyone that the United Way of Southwestern Pennsylvania is available to answer your calls and questions by calling 211. United Way representatives work with us at the health department to stay up to date on COVID-19. They can also connect people to poison control or a group of on-call nurses to answer more detailed questions. It's an incredible service, and I encourage anyone with questions related to COVID-19 or for resources to reach out to 211. One final reminder, it is not too late to get your flu vaccine. There have been 23 cases of flu reported thus far in our county, so please visit the health department's flu map to find a location to get a vaccine. So thank you for your attention. I know most of you are probably watching the Steelers, but for those few who are nerding out with us here at the health department, please stay safe and be kind.
The first question that we have is from Spotlight PA. On November 23rd, the state health department ordered hospitals to reduce elective surgeries if certain metrics for case counts and staffing were exceeded. Does the county health department have any plans to put stricter mitigation efforts related to hospitals in place?
The answer is no. Again, our county hospitals really do have very careful, thoughtful, robust plans to respond to bed space. And if they need to cancel elective surgeries or non-urgent surgeries, I trust them to do so to meet the needs of the patients in our hospitals.
This next question is from WPXI. The number of PCR tests reported each day appears to be dropping. Why do you believe this is happening, and are there any concerns with testing availability in Allegheny County?
So I look at the data a little bit different. So starting around the middle of November, we really increased our amount of testing. We went from tests around 2,000 a day to well over 3,000 tests a day, and we sustained that to right before Thanksgiving. And then we saw a drop off from Thanksgiving in the last few days, and we suspected that would happen because we, for instance, our testing site, which has been seeing over 500 patients every day for the last couple of weeks, was closed Thursday, Friday, Saturday, Sunday. Other sites also weren't testing and were closed. And so we expect by the end of the week, again, that we'll see a resurgence in the test numbers that we have in the county.
This next question is from Pittsburgh Business Times. It's a complex question, so I'll be happy to repeat any piece of it. Now that there have been more details announced about the plans for the vaccine or vaccines, can you talk more about how the Allegheny County Health Department will be facilitating this process? What are the county's plans to supervise any piece of it or take part of it when the vaccine is available to the county? And what are the county's plans to educate residents on the vaccine and its safety to encourage them to take the vaccine?
Well, first of all, I'm super excited about the vaccines coming out, and the data to support them is really stupendous. In terms of the county, the first rounds of vaccine are really coming to the healthcare systems and not to the health department, or they're going straight to UPMC and AHN and St. Clair and Heritage Valley to immunize their healthcare workforce and also to immunize our long-term care. And that will not be led by the health department. The health department really comes into play in phase 2 and particularly phase 3 of the CDC plans on immunization. So we will work with the state health department on that. We are working on our plans. I promise that when they are more robust and more ready for the big time, I will share those in grand detail with anyone who'd like to know them. Needless to say, we are working with lots of community organizations and healthcare organizations to make sure that the vaccine distribution will be equitable and fair and robust. We're also been doing a lot of legwork on really understanding vaccine trust and healthcare trust. And as we get that information, we will use that to help develop our plans carefully. So stay tuned. I hope right after the first of the year to be able to provide much more detailed information about our educational outreach and all of our vaccine efforts in the county.
This question is from WTAE and is also related to testing. The governor announced additional testing sites here in the region recently. Is testing where you want it to be right now? We're hearing about people who still have to wait for tests. How concerning is this to you? And what would you say to someone who has been waiting to get a test?
Testing has been a problem on and off throughout this pandemic. I feel like we're in a very good place in our county compared to a lot of other places. Again, we have the curative test van that's now going to be going all over the county, and we hope to have a second van to do that as well. I think there was a huge push for testing before the Thanksgiving holiday. because of a couple things. One is people wanted to travel and they want to get tested before they went. There was some guidance from the state about getting tested. And so that really pushed the demand, along with the huge number of cases that we were seeing that also drove the demand. So I'm hoping with our added test capacity that we're reaching most people and meeting the needs. It's still not perfect, but we're getting there.
I have a number of members of the media who are also texting us to let us know that the game is now tied at 7.
Okay, thank you.
For those who are watching with us.
Well, I'm glad those people have 2 cameras, watching us and
Multitasking.
multitasking.
Another question from WTAE. Are you still expecting a post-Thanksgiving spike in cases beyond what we've seen already? And when would you expect to start to see those case numbers rise?
I'm worried about that, and I'm waiting to see. I would expect that they will rise over the next week or 2. We certainly have had a couple of cases that we've already identified who reported going to large family Thanksgiving events through our case investigation. So I know there were large events despite our recommendations, and I'm hoping we don't see a surge, but again, I'm not a good predictor.
This next question is from Spotlight PA. What are the county's plans to support hospitals should they become overwhelmed? Are there plans to deploy any county resources to augment hospitals, for example, staff, or activating a field hospital or other emergency response plans?
So Allegheny County itself, we have a lot of bed capacity. We have a lot of really an enormous capacity here in our county, but we are part of a much larger region that has much smaller hospitals in those regions that have less capacity. And so, we had plans that were developed for an alternate care site, really for a regional alternate care site if needed. And so those are there if we need them. And we're looking, again, we are part of a larger region. I don't know if County Executive wants to talk a little bit more about that, but we always have emergency preparedness plans working through our regional alliances. So right now, that's not being activated, and we have capacity. Do you want to address that a little bit more?
Yeah, no, thanks, Dr. Bogan. And it's exactly right. I mean, we're obviously part of a much larger region, and some of the other counties don't necessarily have the type of bed space and capacity that we are so fortunate to have here in Allegheny County. In talking to all of the facilities that she had previously mentioned, they can certainly expand bed space if needed. The problem becomes you can't expand staff. And that's the real issue, is going to be having enough staff to take care of the patients that are there. And that'll be the case whether it's in Allegheny County or one of the surrounding counties. So the plans are in place. The plans that were in place back in the spring would still, if need be activated. But I agree with Dr. Bogan. I don't anticipate that we're going to need physical locations, physical space to expand. The challenge is always going to be with having enough staff, and staff that is already becoming, quite frankly, stretched thin to be able to take care of all the patients that are there.
While you're there, first of all, the media is not shy in correcting me. It's actually 7-6 Ravens, so I apologize for
Okay.
that. But separately, can you talk about public messaging, both of you? How challenging are your jobs when people don't trust information or data or science that is around the virus?
Well, I'm going to disagree a little bit with the premise, because I think most people do. I think most people have a lot of trust, first of all, in Dr. Bogan. I think she's proven over the last 8 or 9 months as this pandemic has gone along that the advice she has given and the strategies her and her department have done have shown that this region is as bad as November was. We're still doing better than other places around the country. And I think whether it's at the national level, whether it's at the state level with Secretary Levine or with Dr. Bogan, and all the robust healthcare experts that we have in this region, I think most people do have a trust in what is being said. The challenge is obviously sometimes we get too relaxed and we slip. And I think what we've seen through the months of September and October and now through November is that's exactly what happened. I was much more worried back in August and September when all of our college students were coming back, almost 100,000 college students, and all the schools were opening up and sports was opening up. But what we saw then was people were so very good about making sure the colleges did a great job with their student bodies, with their staff, with their faculty. And then we got into October around Halloween, and people started to relax. And while the official functions of school, work, retail, restaurants, all those things were done well, people would go home and they would have gatherings with their neighbors, with their friends, school kids, after school programs, after season banquets of the sports teams or whatever it might be. So that's the lesson that I think we try to continue to impart. Dr. Bogan says it again and again and again, and all our experts say it. The virus doesn't take time off. It doesn't work 9 to 5, Monday through Friday. It's there 24 hours a day, 7 days a week, 30 days of the month. So you've always got to keep the mask when you're around people. You've always got to keep distance and wash your hands. Dr. Bogan, you want to talk about messaging a little bit? You've been beating on that pretty good, and we'll continue to.
Yeah. Messaging is challenging. There's no doubt. And that really is, there have been webinars and seminars for all of us public health folks to attend to address this. So this is not just a local problem, it's a national problem. And we're all working on it. The challenge is, of course, that we don't all get our news from the same place. We get it from lots of places. We get our information from so many places. And the challenge really is getting the message out through all of those channels to get to all the people in our society. And that's really the challenge I think that we all face, is the complexity of getting the information through so many different routes so that everybody hears it.
Thank you. This next question is from WPXI. Over the last few days, we've seen the positivity rate about 20% among cases reported each day. Does this appear to be a sustained jump, and how concerning are those figures?
I'm having a little bit of deja vu because I've spent a lot of time talking about positivity rates over the last couple of months. And positivity rates, I'm going to please ask people again, please do not calculate the positivity rate from our daily report. So we put out every day the number of cases that come out and the number of tests that were performed, and then people do a simple calculation of what percentage of those were positive. That is not a positivity rate. A much better approach is what the state uses as a rolling average. And so our positivity rate at the beginning of November on the state website was about 5%. It's now about 10%. And again, the state uses all tests and the proportion of those tests that are positive. When you look at our back part of our county website, we report individuals tested. So if you were tested 10 times and the first 9 times you were negative and the 10th time you were positive, we're only counting that positive. So our numbers seem to be always a little higher because of how we do the calculation than the state, but using the daily numbers is not okay. It's not the proper way to do it. So the daily average percentage of positivity according to the state right now is around 10% for our county. That is a big jump in a month from 5% to 10%. Again, if you use and you look at our data on our dashboard, which uses individuals tested, it's a little bit higher than that 10%, but it's not 20%.
This next question is from the Pittsburgh Business Times. How has business compliance been with masking and distancing? Even if you don't have any specifics, do you have anything anecdotally that you could share anecdotally?
Truthfully, I follow my own guidance pretty carefully, and I don't go out very much other than to come to work every day. But the few times I have been to the grocery store or for errands, I would say that most people I see are wearing masks. But I haven't been to any large gatherings to comment. I don't know if you want to comment on that.
I would agree. I think, again, we talk about the official functions, when people go to work, when they are at a construction site, or at their manufacturing plant, if they're in an office, if they're at the bank, at the grocery store, all those things, the schools. My sense is, yes, they've been very, very good about following the guidelines, and businesses have been diligent about making sure that their customers and their employees wear their masks, keep distance, all those type of things. It's been these after-hour activities of more informal gatherings with kids in school, with people at work, going on travel vacations, after hours that these things have occurred. So I think for the most part, our organizations throughout the region, throughout the county certainly, and throughout the region have done a fairly good job of enforcing and keeping things the way our experts recommend.
This final question is from WTAE. Has the county health department or the county played a role in assessing the Steeler organization's internal mitigation measures, and specifically contact tracing? They're asking because from the outside it's difficult for the public to understand how players in such close quarters aren't all forced to quarantine when a member or members test positive, and college and high school teams have canceled games with similar or fewer positive cases.
Well, the Steelers generally don't ask my advice on, what plays to run or what strategy, but they've been in contact with us locally, with the state, getting guidance, and quite frankly, they've been very cooperative. When the governor or Secretary Levine or Dr. Bogan give advice regarding spacing and capacities and all those type of things, they've been pretty good about being able to follow those guidelines. It's challenging, and we see this game with the Baltimore Ravens, which has been rescheduled a number of times because of issues, quite frankly, that happen more on the Baltimore side than on the Pittsburgh side. But it's a challenge. We see that in San Francisco, the California folks are not going to allow even the 49ers to practice or do anything. They're now using, I guess, Arizona now as their home operation. So we don't know where this will go, but again, we're going to follow the guidelines and go from there. Let me, as we finish up, and I don't know if Dr. Bogan wants to finish, but I want to talk a little bit about some of the announcements that came out today from our federal government regarding plasma donations, vaccines, et cetera, because I think they're very positive. And I think while we certainly are concerned with the numbers, there's some good things coming down the road. And one of the things on the plasma donations, that if you have fully recovered from COVID-19, you may be able to help patients who currently are fighting the infection by donating your plasma. That plasma contains COVID-19 antibodies, which is one way a person's immune system can fight the virus when you are sick. And the Food and Drug Administration, the FDA, has issued emergency use authorization for convalescent plasma to be used in hospitalized COVID-19 patients. And based on the scientific evidence, the FDA has concluded it may be effective in treating the virus and that the known potential benefits outweigh the risk. Donors must have been fully recovered for at least 2 weeks and must meet other requirements to donate blood. And locally, there are 3 sites close by that can accept convalescent donations, including Vitalant Transfusion Services at UPMC Presby in Oakland, Vitalant in downtown Pittsburgh Donor Center, and the Vitalant in Parkway Center in Greentree. And if you need more information, you can visit their website at Vitalant, VITALANT.org for more information. On the vaccine front, we mentioned before that at the UK, they started distributing that today. And in our country, the meeting to discuss the Pfizer vaccine is scheduled for next Thursday, December the 10th, to approve that. And then the Moderna one is going to be a week later on December the 17th. Moderna is the one that Dr. Bogan and I both are in. And you talk about the messaging and trust. I trusted her to tell us that this Moderna one was a safe one to try. And as it turned out, Moderna is one of the ones that have been very, very successful. That's being done here by UPMC Children's under the leadership of Dr. Judith Martin. Now, they're going to be distributing this vaccine, and some of it has already gone out to be shipped to a total of 64 jurisdictions, 50 states, 8 territories, and 6 megacities, and 5 federal agencies within their allocations of the Pfizer vaccine. 6.4 million doses have gone out, and the Moderna vaccine of 12.5 that will be going out and will be available in December. This is all for planning purposes, and as Dr. Bogan said, it'll be the hospitals that will get the first allocation for the healthcare workers that will be doing their things. So as soon as that EUA, the emergency use authorization, is made next week, the distribution will be immediate within 24 hours, and they expect 40 million doses to be put out in the month of December. That's a 2-dose regimen, half the doses. The second half on the Pfizer is 3 weeks after the first one, and 4 weeks after on the Moderna one will be sent in following weeks. So we're getting to a place where we're heading in the right direction, and they're going to be getting these vaccines out over the next few weeks and start to be distributed. So again, we got to keep vigilant for just a little more time. We can get to where we need to go. It is really good news that both Pfizer and Moderna vaccines are coming. And then maybe on the heels of that, the AstraZeneca and the J&J, Johnson & Johnson vaccines seem to also have some success that might be coming on the heels of that. So it was an exciting announcement today was made at the federal level. And hopefully, again, all of us can continue to move forward. I don't know, Dr. Bogan, if you wanted to add anything on final closing remarks.
So I am very excited about the vaccines, but again, they're not going to be out for the general public for quite a few months. And so I'm just asking you again, let's get there safely. Let's limit the number of people who get the infection in the coming weeks so we don't lose more people unnecessarily in our community. I am truly worried for the next couple of weeks, really until the end of January, the beginning of February, till we start getting people immunized. But please, stay at home if you can, limit your travel, limit your interactions with people, and when we have a vaccine, I hope that people will embrace the opportunity so that next fall our schools are back open normally, our children are all back in person. That's really my hope and prayer for our community. So thank you all.